This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission.
A very good evening to you, our esteemed viewer. We want to thank the Almighty God who has kept us alive, who has protected us, who has given us an opportunity to live and see the beauty of today. We welcome you to today's edition of the Family Hour. Edrine Mukalazi is my name, and of course today we are looking at something something that we don't commonly talk about, something that has a lot of misconceptions, yet very, very important in our lives. Now, we are talking about the impact of ultrasound scans, especially in modern medicine. When we talk about ultrasound scan, our friends and our parents call it CATV. So where you we think that it's only pregnant women who go for ultrasound scans. And today, by the end of this show, of course, we shall know whether ultrasound scans were only made for pregnant women. But of course, here we are with the one Godwine Bruce. It's a pleasure having you this evening.
Thank you.
How have you been?
I've been well. How about you?
We are pushing on. Kindly greet our viewers before we get into our cause today.
Viewers of Family TV, it's a pleasure being here in front of you today. We thank God for the gift of life. We thank God for how far He has brought us, and really, we can't say much more than that. So I'm here. My name, like he has introduced me, is Godwine Bruce, and I'm a medical imaging technologist. My work is basically to do ultrasounds, CT scan, then X-rays, as we are going to see as the program is going to be pushing on, because basically I know some of you viewers don't really differentiate what is an X-ray, why do people go to CATV. So
even a CT scan. I mean, there are a lot of things there. There is MRI, what. There are very many things that people would really want to know. And for example, if they tell you to go for a CT scan, how does it differ from an ultrasound scan? Or how does this particular scan differs from is it MRI?
Yeah. MRI.
Those. I think someone would really want to know the difference between all those, and probably the X-ray, because up to now we have people who don't differentiate between a scan and an X-ray.
Definitely.
Yeah.
Definitely. And people who would like to know, I have good news for you. By the end of this show, you will really have known everything that you want to know.
Okay.
So I will begin with the most common, and that is ultrasound. Ultrasound is what we call CATV. So CATV is ultrasound, and I want to begin by clearing a misconception that most of our people out there have. The misconception is that they think ultrasound is for pregnant mothers.
Yes.
No, that is not true.
Because the category of people that we commonly hear talk about CATV. But I'm this CATV, and why do you even call it CATV?
I would be lying if I tell you why people quote it as CATV. Because it brings images just like any other imaging modality, that is to say the CT, MRI, X-ray. But I think CATV, the image on ultrasound is relatively understandable, as compared to other, because now you can easily show a mother that this is a baby and it makes sense, unlike a brain CT or a brain MRI.
Okay.
Yeah.
So you were clearing the misconception that people think it's only for pregnant women.
True. So, dear viewers, ultrasound has very, very many uses. Like, it has a very, very diverse role it plays in medical, other than just pregnant mothers. So I'll first begin by telling you its use. Ultrasound views all the organs, the soft tissues in our body. So when you limit it to only pregnant mothers, you're excluding someone who wants to know whether their liver is functioning well. That is a use of an ultrasound. You want to know your kidneys are functioning well. You want to know you're having issues like constipation, things like that. You're not sure, is it constipation or it is something else? It is ultrasound that will help you to know. So in short, ultrasound is for diagnostic purposes. So most people who want to go for over-the-counter drugs. Over-the-counter drugs are, you feel some headache or you feel some bit of constipation, you run to the clinic. That is, you're just treating what you don't know. So ultrasound will show you what is in your abdomen. What is the problem? Like, you have to know what is the problem first. Because now the symptom is, I'm feeling abdominal pain.
Yes.
But what is the problem? That is the space that we want to cover. What is the problem before you go for
the treatment?
For the treatment, because you're treating what you don't know. Yes.
Okay. So that is ultrasound. What about these others? Because we want to first of all understand all of them, and then we shall get back to ultrasound because that is where our focus is. What about a CT? When do we get to the CT scan now? Because it is also a scan, and for us a scan is a scan. In our lay understanding, a scan is a scan.
True. So a CT scan is also a scan, like you have said. But you can notice the difference in the prices. So CT scan does much more than what ultrasound does. So where ultrasound stops, CT scan starts from there. In cases of things like the abdomen, if I do an ultrasound and I detect, for example, a tumor on a tumor or echizimba, on any of your organs, be it on the liver, be it on the spleen or kidneys, I want to know, is this tumor, okay, the tumor is solid. I want to give the surgeon, because now you're going for surgery, I want to give the surgeon a proper understanding of, okay, how it is big like this, which other organs are affected, because for it gives you very many views. It gives you a 3D view of that tumor. On ultrasound, I'll check and it will give me a 2D view. Then CT will give me a 3D view. So I can know which other organs are affected. So once I see a tumor on maybe the liver, I want to know, because I'm only seeing it on its surface, the 2D view. So I want to know what is happening behind that tumor. So I will go for a CT. When people who have relatives who have gone for CT, they have noticed that you're put into the CT machine, like that machine, then it rotates around you. You get, there is an X-ray tube that is rotating around you. So it is viewing that, it gives you cuts, like cuts of that tumor. And you will go to your surgeon, or a surgeon will have a clear understanding Whether if it is a fibroid, it is a very huge fibroid, like fibroids are ebizimba ku nabaana. So the surgeon wants to know, do I remove the whole uterus? Do I do hysterectomy? Nabaana yonna njijjamu, or that tumor is removable. Which other organs are connected or are being affected? Yes.
By the CT, so that is a CT scan. And then we've also seen people, for example, someone gets an accident and then they tell them to do a CT, maybe a head CT. Why? So how is it categorized? Is it a different scan that scans the head, and then a different one that scans the chest, and
Yes, you're right to ask.
Yes.
So I'm glad you're helping our viewers to also get this very well.
I'm wananchi like them. We are all learning.
Just like I'm also learning. So what happens is a brain CT. We shall go for a brain CT. Remember, here we have soft tissue.
Yes.
And ultrasound will pass through this soft tissue on the abdomen as compared to where we have a skull. So we have a skull that will not enable us to use ultrasound to do a brain scan. That's why we bring in the powers of CT. Yeah, we employ the powers of CT. So we want to see the brain, which is a soft tissue, which ultrasound would rather do on another day. But then we have a skull. A skull does not allow ultrasound or sound to pass through to view the brain.
Okay.
So what happens is we employ the powers of a CT scan. Once we employ the powers of a CT scan, we are going to be able to view, one, the skull that has been damaged, or if it has been damaged. Then we want to see if the brain has been damaged. And we know why the head is the most tough part amongst all our body parts. It's because the brain is very delicate. So we want to see, has there been any hemorrhage, like has blood flown into the brain, because it is not supposed to go there. So it also helps us to get the prognosis. Prognosis is onomulwadde anaawona.
So meaning you can detect from a CT scan result that
I don't want to sound that way, but what happens?
That's it.
That is it, because that is what happens.
Okay.
Yes.
Well, now before we leave these different imaging facilities, let's also talk about the MRI, because oftentimes we see people carrying parcels that have, for example, written something MRI, and then someone is like, "No, what is this?" So after MRI, we shall also look at an X-ray, so that we now get the difference between all of these, so someone can now see exactly what we want to talk about, and probably they draw a difference themselves.
Okay. So, dear viewers, I also want to, like, I've brought in the powers of CT, and now you somehow, I believe you've understood. So MRI in full is magnetic resonance imaging. So MRI uses some bit of a magnet, and then it interacts with the protons in our body, and then we get an image. Unlike CT, CT uses X-rays, and X-rays are dangerous. That I want to look into the camera and tell you, X-rays are dangerous. So if you have a way of avoiding X-rays, to you, I don't want to really categorize, but people who do smoking, for example, you're putting your life at a risk of getting X-rays, and it wouldn't be good for you to attract yourself or to put yourself in a position to go for an X-ray. So MRI does not use X-rays. So that means MRI is also as safe as an ultrasound. However, ultrasound is limited to some cases. So we'll bring in the powers of an MRI. We want to see, just like I've been telling you about the tumor. You want to really delineate how a tumor is. You want to really delineate, are these cancerous cells? Like, we want to rule out, is it cancer? So that's when we employ the powers of an MRI. So MRI, we have brain MRI, chest MRI. We do a MRI of the abdomen. We can do all those. So what MRI can do, even CT can do. However, if you really want to look at, for example, the bone, when you're more interested in the bone, like sarcomas, you want to know if there is cancer of the bone, like you want to really know. You detected something on X-ray and you want to know, you will go for CT. And if you're dealing with soft tissue, the liver, you will go for MRI. And dear viewers, you will also notice that the prices are not the same. The prices are not the same. So there is the ideal. You may be in for a CT, but then even like you may be in for an MRI, but even CT can give you the same results, but it is relatively cheaper as compared to MRI. Then CT will do. Yeah.
So you talked about an MRI that can be used in the place of an X-ray. Does it mean that, for example, in a situation where I get an accident, they can still use MRI to detect maybe the fracture and the damage on a bone?
Yeah, even MRI can give you that, but for more clear bone detail, they will recommend a CT for you. They will recommend a CT for you. But then if you want to know whether the liver has been damaged, or the intestines, or the spleen, or pancreas, in an accident, MRI may do you better. And then MRIs are really not so common. We have a number of them, like very few MRIs in Uganda. So I will not mention districts or something, but like from here, I come from Masaka. I'm a born of Masaka, and hello to all Masaka people. So we don't have one in Masaka. And if I get an accident and CT can give me, but the doctor is recommending MRI, so you weigh the risk. Will this person first travel to Mengo? Or we can do CT, we get the problem and we begin on treatment. Then MRI can come later on when you've stabilized, because CT can also give you.
Now, like we said earlier, we are looking at ultrasound scans specifically, but I think it was important that we understand all this, because you realize that for us here, the lay people, we just hear these things, or maybe you find a facility having all these imaging center, then they have all those details, but you never know what does what. And so I think it was important that we understand this. Now we get back to this ultrasound scan that you explained initially. So someone would really want to understand how it works as an ultrasound scan. For example, I've come to the facility, I just see something, you just roll, and then how does it work? What is the magic behind that to get that result?
Okay. It is a little bit complex, but I will try to shed a picture for a layman to really understand what happens. So, like we have mentioned, ultrasound. So we are going to get images of your body part that we are interested in by use of sound. But then it is not normal sound.
Mm-hmm.
It is ultrasound. So
You'll explain that sound.
So it is. So ultrasound is very, very high sound that it is beyond the megahertz that a normal person or a person can really listen to. So it is very high sound that you cannot do what?
You cannot listen to.
So what it does, we push that sound. So different tissues in the body reflect that sound differently. So once I send in, the head of the baby will not reflect the same like the chest. So it will also not reflect the same like the femur bone or the bones. Or the liver is not going to reflect the same as the bowels. So in brief, we send in sound, very harmless sound, that I have to emphasize, very harmless sound that then reflects back, and that machine that we use converts it into an image.
There is a lot of science there, but anyway, I think we shall eliminate some of the science there. But I'm interested in, for example, a baby in the mother's womb. So when you send this sound, does it mean that the baby will hear the sound and then respond, or what is the magic there?
No, the baby will not hear. But the tissues, the tissues of the baby are reflecting that sound. And that the reflections are converted into an image. That is the image that we will see. And they are remember, they are reflecting differently.
Okay.
Yes.
Now, for us, we cannot even interpret some of these things because we just see some light somewhere in the dark stuff, and then you people try to explain this and this, but I mean, to us, they don't make sense. True. Because they're not understandable. For us, we just see light somewhere, and then you see some brighter light. Does it mean that that's where the problem is, where there is maybe some whitish color, and then you see this other part is dark?
Okay. For the part of interpretation, you can really leave that to the person who is working. Like, I mean, to the radiographer or imaging technologist or sonographer, whoever is working. So
you can ask them and they interpret for you?
Yeah, they can really interpret for you, but most cases, cases of interpreting images, it may be a very, very complex topic or something. But what we normally do, we write reports and we explain. Because everyone has their specialty. Even someone who is not in the radiography department, say a nurse, a doctor, a clinical officer, they may not be in position to really go into that detail that you want me to give the layman. But what really happens is we write a report, and you, as a patient, you have your rights. We explain to you, even if you don't understand the radiograph, but we shall explain to you. Nyabo kakati omwana ndaba tazanya, azanya mpola, things like that.
Okay.
Yeah, so we really put it in very understandable language for you to understand.
Someone would ask, much as we say that, we commonly think that this has been limited. Okay, we think they are limited to only pregnant women and all that. But we also have pregnant women who don't go for scans because there are a lot of misconceptions around the scan will kill the child, the scan will reduce your life expectancy, and very many things that are surrounding scans. But maybe if you can take us through some of the uses or importances or advantages that are associated with ultrasound scans, and why someone should actually take it in good heart when they are told to do an ultrasound scan.
Okay. So I'm really going to begin by assuring the people once again, ultrasounds are totally harmless. Nothing will happen to you when you go for an ultrasound. In fact, they are only advantageous to you because, now I'm going to answer your question.
Yeah.
We have different types of ultrasound. We have obstetric ultrasound, that is for pregnant mothers. Now, why do we advise an ultrasound scan for pregnant mothers, or even begin by telling them to go for antenatal? With advancement of technology, you will really realize that the number of mothers who have lost lives while giving birth has really dropped so high. And the drop is because of the ultrasound. Ultrasound, pregnant mothers or anyone who is getting ready to get pregnant. So, a baby is presented in a way that the head comes first and the legs have to be up. But then there is no assurance that, or there is no way you will know that your baby is facing the right way. Once the baby is not facing the right way, the solution is we are going to go for surgery. We are going to go for cesarean section. Oba bagenda kuzaaza na kiso. If you try to push, because you didn't do ultrasound, you don't know whether the baby is really, you're going to push, and chances are high you will not deliver. You're risking your life. In the middle of giving birth, they will now rush you to the theater. You have already pushed, you're tired, you get. So you have to know, will I be able to produce? Secondly, you have to know what is the number of children in my like the pregnancy. Is it a multiple pregnancy? You want to know, because the way you're handled if you have twins is not the same way you're handled if the baby is one. Then there is some other thing called placenta. Placenta, to people who really want to know it in the local language, Baganda normally call it omwana ow'emabega. And that thing is supposed to feed your baby. So what happens if the placenta comes before the head that is supposed to present, and there is no way you're going to notice that without doing an ultrasound. So you're going to try pushing, and the placenta bleeds like too much. It is made up of almost blood. So once it bleeds, chances are like 85 to 90% the mother will die. So you don't want to push and rupture the placenta. So those are things. It is 100% helping your safety and your baby's safety. Then there are other people. You find the mother doesn't know when she got pregnant. The mother doesn't know how, like, you get. So you want to know, when do I give birth? Such that you prepare in advance, because you want to produce from a hospital. You don't want to produce from the car or from
or maybe at a workplace.
At the workplace.
You came for work in the morning, and then before you know things are
you may even produce from the workplace, and the next day you don't want to come back. You lose the job.
Well, let's take a short commercial break. When we return, we are going to continue from there. Kindly stick with us.